Welcome to Lifestyle Med with Dr. Jade. Health, it's a lifestyle.
Hey family, and welcome back to Lifestyle Med with Dr. Jade. And today we are talking birth control. What are the types? How effective are they? Which one is right for you? If you're wondering, then hang around. This is the video for you. If you're new to my channel, welcome. I'm Dr. Jade. I'm a family medicine physician resident, and on this channel, we talk all about fitness, nutrition, and primary care hot topics. If these are topics that are of interest to you, peruse around the channel. Make sure to hit the like button on this video, subscribe, hit the bell so you never miss a video. We'll be releasing videos weekly on Wellness Wednesdays, okay? So join our family here on YouTube and on Instagram at Dr. Jade MC. Okay, let's get into the video. So let's start with the category of least effective. Which types of birth control fall under this category? In this category, these are considered the least effective because 12 to 28% of women who use these methods end up pregnant, okay? So that's why they're the least effective, because they have the highest percentage of women who will use these and still end up with a baby in their uterus. The first three in this category of least effective would be spermicides, sponges, and I'm gonna look down at my notes, female condoms. I don't see very many people use any of these methods, so I'm not gonna go into them in very much detail, okay? The spermicides can be a foam or a cream that you put in the vagina that helps to kill off the sperm. Not the most effective, okay? And that's why it's in the least effective category. And then, the female condoms, barely ever see them. Don't even know if they're still carried. You do need a prescription for them. So also not highly recommended, although they do moderately help to decrease sexually transmitted infections. We'll get to the best method to help prevent sexually transmitted infections soon. And the sponge, it's basically a sponge that also helps to prevent to provide an environment that the sperm do not thrive in. Those three I'm not going to talk much more about than that, because you don't see them often. They're not highly recommended by physicians, and although they can help with decreasing your risk of getting pregnant, they are definitely down at the bottom of the barrel with the least recommended of the methods, okay? So let's get to the next ones that are in this least effective category. So the next method that's in the least effective category is called fertility awareness, okay? Also, some people will call it the calendar method. Some people will call it the fertility method, ovulation method. So basically, women who have very regular periods, whose periods or menstrual cycles happen at the exact same time every month with no question, like clockwork. Some of those women will opt to just look at the calendar. There are also apps that tell you when you're ovulating based on when you start your period each month. And they'll just look at the calendar, they'll figure out when their ovulation period is, and then they just won't have sex during that period of the month. I want you guys to know that 24 out of 100 women who use this method get pregnant. So that's why it is in the least effective category, because for every 100 women who use the fertility awareness or the calendar method, every 100 women that do this, 24 of them will get pregnant, and that's a significant amount, okay? 24%. So let's move on to the next. The next method of birth control that's in the least effective category is the withdrawal, aka the pull-out method, okay? So this is when the partners are having sex and then the male pulls out his penis when he thinks that he is about to ejaculate. Okay, we're gonna be talking about, this is a sex related topic, so we're just gonna use the terms, guys. We're not gonna act awkward about it, okay? So the pull-out method, what I want you to know, and I am gonna be referring to some notes so I can give you the accurate numbers here. What I want you to know is 20 out of every 100 women that use this method end up pregnant. So if you take 100 women who use the pull-out method or the withdrawal method, 20 of them get pregnant, okay? And this is based on data from ACOG, which is the OBGYN association. And the last method that I want to talk about in the least effective category is the male condom. Most of us know what a male condom is. It is, I think I'll put a picture here, okay? For most of these things, I'll probably put some pictures here in the corner for you, so for some visual aids here. But, what I want you to know is highly, highly, highly recommended, even when we're using some of the moderately and highly effective treatments or birth control methods that we'll get to soon. Condoms, male condoms are so highly recommended. Why? And that is because it is the only method. I hesitated because the female condom, like I said earlier, does also moderately prevent STIs, sexually transmitted infections, including HIV. But the best method of all the birth control methods are male condoms at preventing sexually transmitted infections. I'm going to do a separate video at some point on sexually transmitted infections. I get a lot of questions about those in my office, or I just won't go into it, okay? I get a lot of questions about sexually transmitted infections. So, to prevent them, male condoms, highly recommended. If there's anything I can give you out of this, is to use male condoms in addition to one of the better effective categories of birth control that we'll go over next, okay? What I want you to know also, though, is looking down at my notes, 13 out of 100 women who use male condoms only end up pregnant. So that is why it is in the least effective category, because if you take 100 women, 13 of them will get pregnant using male condoms only, all right? So that's what I want you to know. And that's a question I get a lot from teens, is if I'm using condoms, can I still get pregnant? Yes, okay? So let's move on to the next category, the moderately effective category. And in this moderate effective category, 6 to 12% of women who use these methods still get pregnant. That's why they're moderately effective. They're pretty good, but there is still a margin of error that is significant if you are trying to prevent pregnancy. So let's get into those types. So the first one that the first three I'm gonna kind of clump together because I don't see them as often, and that is the diaphragm, ring, vaginal ring, and patch. So the diaphragm is like a silicone ring that is, or device, kind of cone shaped, that's placed inside the vagina to protect the cervix or cover the cervix, to kind of create a barrier to block the sperm from entering the cervix and getting the woman pregnant. These are often used in combination with spermicides, so the thing we talked about at the beginning that's in the least effective category, to help reduce. I see these really rarely, so I'm not gonna go into them. I don't highly recommend them, so that's another reason I'm not gonna go into them. The patch and the vaginal ring, there's a vaginal ring that you can place inside the vagina, and also a patch that can go right on the arm, and those slowly release hormones into the bloodstream to help prevent pregnancy. Again, they're not my highly used birth control methods or my highly recommended birth control methods, so I'm going to just go on to the moderately effective category birth control methods that I see more common in a little more detail. So let's talk about the pill, okay? OCPs, oral contraceptions, the pill, the birth control pill. It has all types of names, right? This is a video in itself, okay? Birth control pills, what they're used for, the side effects. That's a whole topic in itself. But what I want you to know is that 8 in 100 women who use the birth control pill still get pregnant. So for every 100 women, there are about 8 women who will still get pregnant using the birth control pills. This is another question I get asked quite a bit, is how effective is birth control? And the reason that the moderately effective category is here is because there's just more room for user error, okay? So if I forget my pill, that is going to increase the risk that you can get pregnant. If I take it at a different time each day, that's going to increase that risk for getting pregnant on the birth control pill. So about 8 in 100 are going to get pregnant using the birth control pill. High margin of error in taking those that we see, because it's just easy to forget to take a pill every day. I do have, again, I can do a whole video if you're interested on this. I do have tips on how to remember to take your birth control if you do choose this option. But it's important to know that birth control pills can also be used for other health problems, such as acne, regulating your menstrual cycle if you have irregular cycles. that again could also be a whole nother video. So it can also improve other health issues, but it also has some significant side effects and multiple health issues that if you have any of these health issues, you should not be on birth control pills. That's a whole nother video, okay? So if you're interested in any of those topics, because this is just such a big topic, then let me know in the comments and I can do a separate video on those. But I want you to know the types and how effective they are in this video. And so 8 in every 100 women do still get pregnant on birth control pills. And the last method I want to talk about in the moderately effective category is the injection or the depot shot, you will hear. And this one is more effective. About 4 in every 100 women get pregnant doing the depot shot. And again, that's because there is some user error here, more so a timeline error that can increase that risk. So this is a shot that you would get every 3 months in your doctor's office to prevent your pregnancy. It's a hormonal shot, progesterone. I won't go over all the types of hormones and estrogen versus progesterone. I won't go over all those things here in this video, but let me know if you are interested in any of that. But what I want you to know is that if you take 100 women, about 4 of them will get pregnant on the depot shot, and this is because you want to have it every 3 months. And you know, sometimes it can be hard to get in and get another appointment, and to stay on schedule, you may forget your appointment and then come in a month late to get your next shot. That is all going to increase your risk, of course, of getting pregnant. Okay guys, and this is the moment you've been waiting for, the most effective category. Which forms of birth control are the most effective in preventing pregnancy? In this category, less than 1% of women of all these methods, less than 1% of women will get pregnant if you use any of these methods for your birth control options. So let's get right into these. The first form of birth control in the most effective category is called the implant, also called by its brand name, the Nexplanon, and there may be other brands that come up by the time you watch this video, but it's a small rod-shaped device. It looks like about the shape of a matchstick, like the old matches where you light. It's about that size. It goes in your inner arm here, and you know, it's put in by your doctor, right in your doctor's office. And it is very effective. It lasts about 3 years. So you get it put in, it lasts 3 years. And what I wanted you to know is that 0.5 out of 100 women will get pregnant using this birth control method. What I want you to know is that nothing, okay, is 100%. There really are no birth control methods that we can say this 100% will prevent you from getting pregnant. But we are pretty darn close, okay, especially in this category. So for every 100 women, 0.5. I don't even know how they calculated 0.5 of a woman, but they look at all these women and the average was about 0.5. So very, very, very small percentage of women who have that Nexplanon place will get pregnant. The next form or type of birth control in the most effective category is the IUD, the intrauterine devices. It's a small T-shaped little device. I'll put the picture here as well. And with that one, it is inserted by your physician in the office into your uterus. We do these in our office. And what I want you to know is that there are different types, okay? I get a lot of questions on the types of birth control. They have different brand names. There's the Skyla, the Mirena, there's the Copper. You know, they have these different brands, and the different brands last different lengths of time. One of the types lasts 3 years. One of the types lasts 5 years. One of the types lasts 10 years, okay? The Skyla is 3, the Mirena is 5, the Copper IUD is 10, and they have a little bit of a window there, so you'll see some sources say, you know, 10 to 12 years. But the point of this all is that there's a hormone releasing IUD and there is a copper IUD. Again, IUDs will be a whole separate video, but the overview that I want to give you is that it's placed in the uterus. The copper is a hormone-free option, but women typically have some more adverse effects or side effects with this one. which is why typically for most patients, will, depending on their history, will recommend the hormonal versions over the copper one, but that's a whole nother recommendation. I'm not giving you medical advice here. Talk to your doctor about which one is the best for you, but I just want you to know that they work differently, okay? So, and they also have different lengths of time that they are FDA approved for working. So that's why in general, I will tell you that there are different types of IUDs. They're all placed the same way in the office. The procedure to get them placed is all the same, but they work differently, and depending on which IUD you get placed, they last a different period of time. So very important to discuss if IUD is an option, a good option for you, or the best option for you. Very important for you to have that discussion with your physician on how long you want this one to work, like how long you want to prevent pregnancy, and looking at your health problems, what side effects, and do you want the hormone versus no hormone, okay? So I'll move on from IUDs because I could go on and on. And the last type of birth control method that I want to talk about in the most effective category is the sterilization methods, okay? The way to permanently stop having kids. And there is male sterilization, where that is an outpatient procedure just in the outpatient clinic. Men go in and undergo a vasectomy, and that is called male sterilization. And then women, they actually have to go to the OR, and it's a more invasive procedure, but they can also get sterilized, and there are multiple techniques on how this is done by my beautiful, wonderful, intelligent OBGYN colleagues. And so I will leave that to them to explain in more detail on what they do in the operating room to do female sterilization. But what I want you to know is, when you think about if you want to get a sterilization procedure done, I do have some patients that go into this with the mindset of that it is reversible. And I want to really, really have you think about if there is a chance that you may still want to have children, please consider some of the other long-acting reversible contraception options, or LARC options, which would be the next one on the implant, the IUD options. Those would be better long-term options if you think there's any chance that you may want to have more children. But if you know 100%, without any shadow of a doubt, that you are done having children, don't want to have to think about it, don't want to pop a pill, don't want to put a patch on, etc., then sterilization may be an option for you. And to know that male or female sterilization, or both, whatever, works for you and your partner, those are options. With every type of birth control, you guys, there are side effects. So go over those with your doctor. What are the side effects? What are your specific health issues that would make which birth control method basically would be the best for you and your specific individualized health. So in this video, now you know the major types. Now you know how effective those types are, if they're the least effective, moderately effective, or most effective category. Now we want to use those questions I told you at the top of the video to say, okay, and now I understand what they are, the types. I do need more information from my doctor on the side effects and what my health looks like. But let's now see which of these is right and best for me. That's what we want you to look at as an individualized basis with your primary care physician. If you have any other questions about pertaining to birth control, this is a huge topic, right? And I covered the surface here on this one. So if there are any more specific questions you have about birth control, contraception, then please send me a comment. Join our family on Instagram at Dr. Jade MD, and we can talk more there as well. And let me know what you guys want to hear. Was this content helpful? Was this information, of value? Then please let me know in the form of a like. Join our family by subscribing and hitting the bell so you never miss a video. I will see you next week on Wellness Wednesday. Videos released weekly on Wednesdays. Love you guys. Thank you for supporting, and I'll see you next week. Bye.
If you enjoyed the music on this channel, make sure to check out the description box for your own custom music by C Major Nation. And as always, be sure to like, comment, share, and subscribe. Thank you, and God bless.